Hi, so my name's Ailsa and I'm a fourth year medical student, and today we're going to just talk to two consultant haematologists a bit about their job and what inspires them about it. So I'll just let them introduce themselves.
I'm Susie Morton, I'm a haematology consultant in Birmingham. I work jointly for NHS Blood and Transplant and for University Hospitals Birmingham. So even in haematology I have a slightly unusual role, but we can talk about that a little bit more.
And I'm Haidar Hussain, I'm a consultant haematologist here at University Hospitals Birmingham.
Great. So first of all, for those who don't know, how would you describe a haematologist? What does your job entail?
So we might have slightly different takes on it. So normally when we talk about haematology, we talk a lot about blood cancers, so leukemia and lymphoma, which is probably the majority of the diseases that most haematologists treat. But in my role, I'm always very quick also to point out that there's another side to haematology, which is often dubbed non-malignant haematology, which we always say we should never define ourselves by what we don't do. But essentially that encompasses a couple of different things. So hemostasis, so for example, patients with bleeding disorders like haemophilia. Sort of laboratory medicine in terms of diagnostics, so we do work looking down the microscope at blood films and also at bone marrow biopsies. We do transfusion medicine, which is mostly what I do. Red cell stuff, so people have hemoglobinopathy, sickle cell anemia, things like that. And also sort of immunohematology, which is kind of the autoimmune problems, so people might be aware of things like autoimmune hemolytic anemia and immune thrombocytopenic purpura. And we also do a lot of liaison work, so you might be a doctor who's not a haematologist, but you might have a patient who's anemic or has a low platelet count, has deranged clotting, or is bleeding or clotting, or has a transfusion problem, any of those things, then we'll take phone calls and sort of speak to people about that.
So quite a range of things.
I like to think so.
Yeah, I mean, haematology, a lot of people kind of think of it as people in the lab and looking at microscopes. But yeah, we're pretty much involved in every aspect of healthcare, both with GPs, you talk about liaison, and providing advice, neonatal units, intensive care, surgeons. We're there, we both provide advice with other clinicians, and also we look after patients ourselves. So that's the other thing, that sometimes people are a bit surprised to find out that we have our own patients, we see them in clinic, we see that we look after them on wards as well. And treating cancers is kind of a big part of our work, but as you say, there's a whole kind of much wider area aspect of it, and it's very diverse, which is so great.
That's what's really come across, is the diversity of roles you do.
And probably fair to say that as a haematologist in training, so be it at a sort of SHO level, but sort of foundation and higher level, and then from registrar upwards level, a lot of your time you will spend looking after inpatients on the ward, and that side of things can be very intense, and there is a big clinical sort of workload associated with that. So I think it's really important to understand that it's not just sort of lab and liaison, there is a lot of direct patient care as well.
That's really good. And so what would a typical day be like for you, or is there really no such thing?
So it'd be slightly different for both of us. So because a lot of what I do is to do with transfusion medicine, and I work for the blood service as well as the hospital, I actually spend a lot of my time in meetings with different people, talking about how we're providing blood to individual patients, but also as a kind of a programme within the hospital. So have we got the right infrastructure in place to make that happen as it should do. I do some research, I do lots of teaching, so not just teaching of our haematology trainees, but as you can imagine, everyone in the hospital needs to know about blood, so there's a lot of teaching going on. So quite a lot of my job is actually kind of more about strategy as well, but then I do lots of liaison work, people emailing me with specific patients, and then I do a clinic, which is a kind of a general haematology clinic, but sort of encompassing a lot of those liaison things, iron, immunohematology, that sort of thing. It's a little bit more traditional probably in terms of what he does.
So I mean, it varies very much week by week, but I mean, I guess just to take you through my day to day, it started off with a meeting discussing all the inpatients who we're currently treating for hematological cancers. I've just come off an on-call block, so I was working last weekend seeing these patients, deciding on what treatments people should have. After that, I went to the laboratory. I know it's stereotypical, but I was looking at it. It has to be done. Yes, I mean that's very much my diagnostics is my area. So I was looking at the patients who had seen bone marrows and kind of putting out reports for that, and again that would be contributing towards meeting. We then had an multidisciplinary team meeting where we discussed all the new diagnoses of patients with cancer across the whole trust, and again discussed their treatment plans. And then I came here for this interview. So you know, it's very variable, but you know, it's that's what's so enjoyable about it.
Yeah, no day's the same.
Exactly. Yeah.
And I think what's really nice as well, that I think a lot of us were drawn to haematology because of this, is exactly as Haida says, you're seeing the patient on the ward round and then you're going to the lab and you're looking at their blood film or their bone marrow biopsy, and I think that kind of really helps to put the laboratory aspect into a clinical context, which I don't think you get in many specialties.
No, so you've got a bit of like continuity of care, you see them through the pathway, that's great. And so as you say, what were the appeals to being a haematologist for both of you really?
Well, I can
sure we'll start.
Yeah. So most haematologists, I think it's fair to say that you'll speak to, will say that they probably came into haematology by accident almost.
Mm-hmm.
So you know, when I was a medical student, I wanted to be a renal physician. That's kind of what I was interested in. Probably gives you a bit of an image of what we're like. But you know, it was just by chance that one of my foundation jobs was a haematology job, and it was my last foundation job.
Yeah.
And you know, it was great. I mean, you know, you saw the patients, you got to know them, you got to speak to their families, you saw them through that pathway of treating them, and you know, a lot of it comes down to role modelling. You know, the kind of people that you're working with, the team that you're working with, the nurses, and you know, it was the whole package for me really. That's kind of really what I like about it.
Yeah, so it's like a positive experience drew you into it.
Yeah.
I agree. It was pretty similar for me actually, and I think the real shame is that actually a lot of medical students and even foundation doctors don't get any exposure to haematology as a career. And it was said to me actually as a medical student, haematology is a postgraduate topic, and I'm like, bet everybody looks at blood counts every day. How can it be a postgraduate topic? And I think what they meant was that the kind of intricacies of how you treat leukemia and lymphoma are very subspecialty, and I get that. So similarly to Haida, actually I wanted to be an endocrinologist, and I was working my way through, and I was actually doing core medical training about 6 months prior to putting in my registrar applications, and as luck would have it, I did a 6-month haematology post as an SHO, which I hadn't asked for, and I hated it for the first 3 months. I was like, because you get to a point where you're kind of really competent in medicine, and you do your foundation program, you become an SHO, you know what you're doing, you know how to manage the medical take, and everything's fine, and then you start in haematology and you're like,
what is this?
Where did all this come from? These are sort of medical patients, but not like I've ever known it before. And we also covered the day unit as part of our job, which is quite unusual at SHO level, and we did the on-call out of hours as well. So we kind of really felt like a baptism of fire, and kind of a big change from what I was used to. But after a few months I settled in, and I always say it's a good job it was a 6-month job, otherwise I'd be an endocrinologist right now probably. And so applied for haematology from there.
Great. And both of you said you sort of came into it by accident, but what is the sort of usual pathway? How many years does it take to become a consultant, etc.?
So I think these things are constantly under review. When Haida and I did it, it was 2 years of foundation training, 2 years of core medical training, which is now obviously IMT. And it's still, as things stand, as of today, only 2 years of IMT, and then you apply for haematology training, and then it's 5 years from there.
Okay.
What used to put people off, I think, in the past was that you need to do your MRCP exams during CMT or IMT. Okay. But then for haematology, you also have to do your FRC path exams. It's like a double whammy of professional exams. So it is a lot to get through, but I would say the advantage of that is that you know and you can see that you're picking up the skills that you need, and it's all very measured, and there is work that needs to be done. But I think that it's by going through the exams, you pick up a huge amount of knowledge and experience from doing that. So I would say absolutely not to let that put people off.
No.
And there's a couple of other things just to mention as well as that haematology. You can go through paediatrics as well. So you can actually do 2 years of paediatrics, do your MRC PCH, and then go through. And it's a bit odd because you start off as a paediatrician more or less, and then you actually do adult haematology. And similarly, if we want to do pediatrics, we can actually do that from adult haematology into pediatrics. That may change with time because that's kind of evolving, but it is, there's again, it's
nice
that diversity.
Little change.
Yeah. The other thing to mention, is that the training route is not, it's not absolutely linear. So lots of people will take time out between my CT2 and my ST3, so between my SHO and registrar year. I went to New Zealand for a year, and I did haematology out there. It was just the best. It was the best. It really was. And then I took another year out during my training where I was a teaching fellow at Warwick Medical School. So, and again, that was a great, little change, step change in my career,
Yeah.
learned other things, kind of took a bit of a break from the kind of the treadmill, and then came back in. But the better
allows
for it.
Yeah.
Absolutely. And other people do PhDs.
Exactly. There's a very sort of heavy research contingent, so lots of people will do MDs or PhDs as part of their registrar training, and you can also come through the academic route, so you could be an academic clinical fellow. Again, as things currently stand, you'd be appointed as the Haematology ACF at ST1, so you'd actually go through your ST1 in 2 years as an academic, and then you would sort of come in at ST3, and the expectation is that you would then do a PhD after your ST3 year.
Okay.
But you can do a PhD at any point during your training, you don't have to be on that programme. And I think as things currently stand, you can also get into haematology through the ACCS route, or the sort of acute care route as well. So yeah, lots of variation, and I think the message that I would give to people is don't feel that you have to be pinned down.
Yeah.
So I came through training as it was intended, very much bang, 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 bang. And actually there are so many opportunities that people can take, and they shouldn't feel afraid to kind of step outside the box, look into other things, pick up extra experience elsewhere, and there are loads of opportunities.
Perfect. So what would you say is the best part of being a haematologist, or just your job in general?
For my job, I really like, one of the things that really attracted me to transfusion medicine is that there's quite a high sort of science contingent to it.
Yeah.
So when you learn about transfusion as a haematologist, you learn all about what's happening, particularly with sort of the red cells and antibodies that people can make and how they interact and what blood you can give to people and what blood you can't. There's kind of just whole loads of stuff around that, which I really enjoy the science of, and then I like seeing patients receiving blood, and when there are complications, what happens and what we can do about it. But also just applying a hefty dose of absolute common sense to what we're doing. And I think people, as they come through their training, they'll realise with transfusion that there are lots of rules in transfusion. There are things you can do, there are things you really can't do. But I quite like, as the transfusion consultant, that I kind of have a bit of oversight of that, and that I can make sort of pragmatic, common sense decisions for the well-being of patients to deliver good patient care, and that's what I like.
Nice. And yourself?
Yeah, I mean, I'm going to say it. I like people. I really like that interaction with the patients, kind of getting to know them over kind of a longer time period, and speaking to them, their families. There are highs, there are lows, but it's a really kind of rewarding career from that point of view.
Yeah.
And the other thing I really like is teaching. Now, you don't have to be a haematologist to teach, but this particularly, I mean, I enjoy looking at complex things and kind of simplifying them and making them kind of, that kind of aha moment. I really, really like it. And haematology offers a lot of opportunities for that as well.
That's great.
I think one of the real things that attracted me to haematology, which is ironic because I do less of it now, but is the continuity of care. So what I was seeing as an SHO was that there were patients coming in and having chemotherapy, spending sometimes up to 3 or 4 months on the ward, most of the time, getting to know them and their families really well, and then they'd go home, and then you'd get a call at 2 o'clock in the morning from the ward, oh, this patient's phoned up and they're febrile, or from A&E, and the A&E would give me 2 sentences about the patient, not tell me their name, and I could tell them exactly who it was. And I think you don't get that in many branches of medicine, especially these days, and not to compare us to other specialties, but I do think that is something that's really special about haematology and probably won't change.
Yeah, like sort of direct links to patients.
Yeah, exactly.
That's great. And you sort of mentioned there was the lows, so what is the things in being a haematologist that is difficult or can be hard to see?
So from my perspective, from a transfusion perspective, I think it is that difficulty for me of how do you get the whole hospital doing transfusion medicine well. It's really difficult, and I sort of have responsibility for a whole thing where I have very little control. So I could do lots of teaching and I could try and persuade people to do things, but that's what I find difficult, and sort of wishing that I could give my personal input into every patient in the hospital that's a bit anemic to try and sort of make sure that they get what I would think to be good care. So that's the kind of frustration, but it's also the driver that kind of keeps me going as well.
Yeah, I mean, I've kind of alluded to the lows. I mean, obviously haematology is a specialty where you do face a lot of patients who are incurable and sadly die, and that's difficult, particularly when you're looking after patients who you get to know quite well and can relate to, and some people do find that very, very difficult actually, and some people do kind of consider even changing because of the impact that can have. The other thing, I mean, not so much for myself, but I do know that quite a lot of people do struggle with the exam side of things, because it is yet another hurdle with a lot of money involved in it as well. But I mean, it's for me the good far outweighs the...
Can be bittersweet, but
absolutely.
still worth it. Yeah. So obviously doctors, you know, do have a life outside of medicine, you know, we are people. So how does haematology allow you to like have a family, you know, do the wacky hobbies you want to do? How does it allow it?
So I think it depends very much on the job that you have.
Yeah.
So I mentioned before we started recording that actually when I was an SHO, I worked in a department where a significant number of the consultants worked 4 days a week, and I didn't even notice the whole time that I was in that post because they were so good. They had such effective handover sort of mechanisms. Everyone knew who was covering what, and it was really clear if you had a problem with a particular patient, which consultant you were asking advice from, and I think that worked really, really well.
Yeah.
Again, in my role, slightly different to Haida, but I do my on-call at the National Blood Service. We have a sort of on-call rota, so that is sort of something that's, because I can be on call from home because I'm covering half the country at the time, that makes things a bit easier from a work-life balance point of view. I actually work 4 days a week, but I do my sort of full on-call commitment and what have you, and that works well for me. And again, because a lot of what I do is sort of strategy, again, I can work from home a little bit, which is different to a lot of doctors, but actually increasingly, and definitely since COVID, I think people are realising that actually there is quite a lot that can be done a bit more flexibly than perhaps we've been used to, so I really welcome those sorts of changes.
Nice.
Yeah, I mean, I work full time as do you actually, but I work a 5 day week, and the consultant's contract is, for most physicians, is quite similar.
Yeah.
You can work as much, you know, there's always more work to do, so you have to be careful to actually balance it yourself.
Yeah.
But you know, haematology does lend itself to less than full time work. There are consultants who are on job shares, and there's a lot of outpatient work that needs to be done as well. So, you know, you can work as much as you want, but you can cut back on that as well, and there's always that option. I mean, you know, I think the main kind of consumption of my spare time is my 2 small children, which, you know, but you know, I drop them off and pick them up. I don't kind of, you know, I see them. I'm seeing them growing up. It's not, you know, I don't feel like I'm missing out. Yeah, you know.
And I think when you become a consultant, I think you have a lot more autonomy than you do perhaps when you're in training. Yeah. So I think that training is often the most difficult time, and I think people are often put off from things like haematology because they think, do I really want to be a registrar for that many years? And I think, you know, it is difficult and it is a consideration, but people should remember that there's a lot of life left after training and to not make any decisions. I've got friends who made sort of career decisions 10 years ago who are really regretting them now, and that's not to kind of say, you know, scare people or anything like that, but just to be aware it looks really different from this end than it does from the other end. Yeah.
Perfect.
Also, just to mention that haematology is a specialty that you can go to Canada or New Zealand with without having to do all their internships over again. So it does keep doors open.
That's quite a big appeal, to be fair. And just sort of finally, so, you know, to any budding haematologist, either, you know, in sixth form or at medical school, is there anything they could be doing to like either, you know, help them get down that path or just sort of inspire them a bit more? Is there anything? Or
loads of things. Yeah, so we always like to hear from people, and people do intermittently email us and just say, you know, what can I do? So it might be anything from coming and doing a taster week with us, and we get that quite frequently, and we'll happily set that up so that you get a range, not just of the ward work, but clinics, lab, liaison, and all the different things. You can do projects and audits. There's always those sorts of things to be done, quality improvement projects, which will just give you insights into what's happening, and often those will lead to things like posters at conferences, which again will give you kind of another door into to what's happening in the specialty. So yeah, absolutely. And I'd say probably the first thing is just to email the haematology consultant in your hospital. They'll almost certainly be very happy to hear from you. Yeah, exactly.
Perfect. So just finally, what would you say is maybe like the most proud moment or the best thing in your career that you've done to date?
It's a tough question. It's a tough question, isn't it?
It's hard to talk about something you're proud of.
Yeah. Well, is like what, you know, one specific thing? I mean,
multiple things.
Yeah. I guess if you to talk about a highlight of my career, I mean, you know, I would probably say going to New Zealand was just, you know, exceptional, and you know, it's more kind of, it's more stepping out, seeing another system, and you know, I very much learned kind of the basics of my laboratory haematology there. I had a good kind of 6 months doing that, and which is, you know, it's interesting. That's where I started off in haematology, kind of at registrar level, and that's where I ended up as a consultant. You know, that as a particular highlight. You know.
Yeah. I'm very jealous. That sounds really fun.
So I'd say for me, it's not necessarily one major thing, but lots of little things. And so one of my kind of mantras in life is to try and take enjoyment and pleasure from little things that happen every day, rather than looking for the kind of the big thing. So for me, it might be diagnosing a particular patient who's been a bit tricky, or solving, you know, they referred to me with something and people haven't been able to figure it out, and I've figured it out and fixed them, which doesn't happen very often, but when it does, it's really, really satisfying. Or more from the kind of overarching transfusion perspective, you know, if you can solve a problem or get a particular system running better. So, you know, when I started in the trust, we had major issues with the major hemorrhage protocol, just getting blood to patients that were bleeding, and we spent quite a long time working on that, and now it runs really well. So for me, that's kind of I feel really happy that that's a problem that we've managed to solve.
That's great. Thank you so much for speaking today, and I hope this has inspired some budding haematologists.
Thank you.
Thanks.
You recorded?
He's taking a retinal scan.